the world of pelvic health, specifically to pregnancy and birth, we have such an amazing missed opportunity to introduce what the pelvic floor is. I actually think we should be talking about it when we're much younger, but definitely in pregnancy and birth, if we can introduce what the pelvic floor is, how we can train the muscles to be responsive to labor and birth, and how we can optimize the postpartum recovery period so that we are less likely to have incontinence and organ prolapse and painful sex and these things that, again, people consider to be normal or just part of being a woman or just something that happens because you've given birth. And I'm excited to share some of my top tips with you today. So I will get right into what the pelvis and the pelvic floor is. So this is a pelvis model, and we're talking about the female pelvis in today's program. And I'm pointing out now from an anatomy perspective, I want to give you a little bit of a layout so you know what I'm talking about and what the pelvic floor is. I do encourage you to use a mirror, even to look at your own anatomy, but for the purposes of this, you can just watch the screen. So at the front, this is a person lying on their back. So you can imagine they have their bum cheeks here. So here's a pubic joint. There's two bones that you could feel sort of through your butt cheeks. And then at the base, we have a tailbone. Those 4 points make sort of a diamond shape, and they form the attachment points for what we are referring to as the pelvic floor. The pelvic floor is a group of muscles, and it's not just one muscle. It's actually 3 layers of multiple muscles. I won't go into naming all of them right now, but the important thing is that the 3 layers, first 2 layers primarily are responsible for continence, closing openings. And the 3rd layer is primarily responsible for supporting our organs. And anatomy here wise, so here is the anus, here is the vulva, here's the vagina, and here is the urethra. And in between, this area here is called the perineal body or the perineum. You may have heard the term perineal massage, which I'll touch on in a few moments. But this is essentially what we're talking about. So the pelvic floor closes off at the base of our pelvis and would be considered the pelvic outlet. So when we give birth vaginally, the babe comes into our pelvis through the top, which is called the pelvic inlet, and emerges into the world through the pelvic outlet. And that group of muscles can respond either by holding on to tension or ideally being allowed to ease and surrender to some of that stretch and pressure and discomfort that we feel to allow our babe to come into the world. So birth is really like pee and poo in a sense. It's an elimination. And so when we are eliminating something from our body, we need those muscles to allow that to happen. We want them to be able to find ease. So releasing tension in the pelvic floor is something that we can do in terms of preparing for birth. And potentially a lot of people, myself included, I was very afraid of tearing. That was my biggest concern. And I know that that is a very common concern for people. And things we can do while we're pregnant to reduce that tension, release some of that fear maybe that we have stuck in our pelvis can really serve us. So how we hold our pelvis is important. Posture wise, what would be considered a neutral pelvis can allow the pelvic floor muscles to be at a more considered optimal resting length. So how we found neutral is if you happen to be sitting, if your vulva is on the surface of the chair and you would feel those 2 sit bones, the 2 hip bones would be in the same plane as our pubic joint. We'd have a nice gentle curve in our low back, and our tailbone would be free from underneath us. A lot of time we spend sitting with kind of a bit of a tucked tailbone, and that can work against us. So not to say we can't ever slouch, but you want to spend time in a neutral pelvis for the majority.
I just did that just then, and you can really feel the difference.
Yeah, and you usually can breathe a little bit easier as well. And the first few times you do it, you might actually feel a little bit of achiness in your low back if you're more accustomed to being in a slouched kind of posterior tilt. That's not to say that it's bad. It's just your muscles are saying, well, I kind of like being lazy. I don't really like to have to work, but the more you do it, the less they will yell at you and the more conditioned they will become to actually hold you in that optimal position.